So let's think about how narrative research could help you in this situation. So if you interviewed, or if you're looking at an article where they interviewed 1 or 2 persons about their experiences in healthcare, you might see that that research exposes that, for example, transgender men have very high rates of mortality from breast cancer compared to other groups. And perhaps in your practice, you have a handful of transgender persons in rural areas who are seeking treatment, but not urban areas. That may be a little counterintuitive. But an in-depth interview with one transgender man and their experience with medical care could also provide a lot of information about how that person understood his cancer diagnosis and subsequent medical treatment. And the other thing that's really useful is that with narrative research, in terms of understanding how one's life experiences have informed a medical encounter, you're going to be able to see how this is helpful, especially in circumstances where there are really hard to reach populations. So, for example, transgender men who live in rural areas are probably not very numerous. I mean, you may be in an area where that's not true, but generally that tends to be the case. So an article that uses narrative research is going to provide a lot of in-depth analysis and data that you could then extrapolate and potentially use to help inform your practice itself. It could also provide insight into some of the reasons that may drive someone to avoid medical care before and after diagnosis. So, for example, stigma. How has this person's experiences in life with discrimination or stigma shaped this encounter or their encounters at a particular medical facility when they're seeking cancer? So a rural area that's farther away from the clinic might actually make sense for someone who's experiencing a lot of stigma in their own home environment, because the rural clinic or the rural area is farther from the clinic. So when they go to the clinic, they're less likely to see people that they encounter more on a daily basis that discriminate against them, right? So if they are afraid of, or if they're afraid of being, if they're afraid of people finding out that they're transgender, maybe the other people in the rural community don't know that they're transgender, then they may be more likely to go to this clinic that's farther away, and thus you're seeing the disparity with people from rural areas may be more likely to go to this urban clinic, perhaps. So this narrative research might give you an understanding of why someone from a rural area might come to an urban area because of their life experience with discrimination, and that's shaping the reasons of why they're making the decisions that they're making that particular day or a series of days about going to a particular clinic. So now I'm going to shift gears and talk a little bit about focus groups. Focus groups are another fairly common, they're becoming more common form of qualitative research, although they're certainly not as common as interviews or ethnography. Observation. So we're going to talk about the basic principles of focus groups, advantages and constraints, how you can evaluate the quality, and how you can use focus group research in your social work practice. So some basic principles of focus group research. Focus groups tend to be basically interviews with multiple people at once, where the group context elicits information that an interview may not. Focus groups are heavily focused on the interaction of the group, whereas in an interview, you're really focused on an individual's perceptions and understanding the processes and how they make sense of a particular circumstance, for example. In a focus group, you may have that same individual participate, but you're really trying to understand how seeing their interactions with the rest of the group shape their answers. And this can be particularly helpful with information that it's interesting. It's like a way to sort of combine observation and interviews, because you're actually observing how people are thinking and talking about the phenomenon with someone else, which can also be illuminating in that it provides that sense of what is someone doing versus what they're saying. And The doing part is what they're doing when interacting with other people. Another thing that focus groups can do is that they can elicit information that tends to be more commonly shared with other people who have similarly shared an experience. So if I'm a researcher and I come in and I don't know anything about that experience, but I'm interested in learning more as a researcher for a variety of reasons, someone might be less likely to share certain types of knowledge or use certain terms if it's just me and this person, as opposed to if it's a group of people who have had similar experiences, they may be more likely to kind of be more comfortable and share some information in that group environment, as well as other people's comments may elicit information that might not have come out in an interview. So focus groups tend to be between 5 and 10 people in number, but certainly I've seen focus groups that are smaller and focus groups that are larger, but on average they tend to not go more than 10 people. So some of the advantages of focus groups is that you really get you can really get a lot of really interesting insight through watching interactions, discussions, and sometimes even debates among group members. Now, one of the main constraints of focus group research is that if the moderator is, and the moderator is often the researcher, if that person is not careful, you may have 1 or 2 voices within the group kind of dominate and override other voices. So when you're looking at research that is using focus group, you want to kind of pay attention. Are they constantly citing one person and information from one person or 2 people? Or are they really kind of providing information from multiple people in the group and really discussing the group dynamic as a whole as opposed to 1 or 2 people? Sometimes research that is focus-based, it can, and this is a trap that you want to be aware of when you're looking at research that uses focus groups, is it can use focus groups as a convenience, as a way to sort of interview a bunch of people at once. That's not the purpose of focus group research. So if you have a research article that says, I did 4 focus groups and I had, 50 people that I talked to, but they keep talking about the 50, that's potentially problematic because a focus group is its own thing. It's not really necessarily meant to generate individual information from 50 people. Although you can use interviews with individual people to buttress the information from the focus group. So that's one thing to sort of pay attention to. So in addition to that, when you're looking at focus group research, when you're to evaluate quality, you also want to see, this kind of goes back to what I was saying earlier about the multiple voices. You really want to make sure that the article itself is capturing the group interaction, it's capturing multiple voices, and it's not just a proxy basically for doing a lot of interviews with individual people. It's actually focused on looking at the interactions of the group and describing what surfaced as a result. So now we're going to shift gears and talk about how you can use focus group research in your social work practice. So as with the previous examples, I'm going to discuss the same hypothetical, but we're going to see how this applies to focus group research more specifically. So I'll read the hypothetical again. You are a medical social worker that specializes in cancer treatment. You work with older adults. While your medical clinic serves patients across several counties, including both rural and urban areas, you have noticed that most of your patients come from one county. This county tends to be more rural. You want to understand what factors may be driving this disparity. How could focus group research help you? So take a minute to reflect on this, and then we will come back and discuss how focus group research could help you in this particular hypothetical or case study.